am Leah Langan Davis Porter. I'm
You've said that
78
3
years-
times.
78 years old.
She has dementia. She says it over and over again.
This is Langan Porter, a beloved grandmother and mom who is seemingly fine from the outside and managing okay, but what about years from now? Vascular dementia, an often long-term and gradual decrease in the ability to think, speak, and function, has begun its process in degrading Mrs. Porter's life and abilities.
Okay, so please say your name.
Langan Davis Porter.
Okay,
How about real Langan Davis Porter?
great.
That's because there would be telling, whatever.
Okay. What led you to find out that you had vascular dementia?
I had a small stroke in 2016, and from there I went to see a neurologist, and she told me that I had small vessel disease.
Small vessels disease often damages the bundles of nerve fibers that carry signals around the brain, known as white matter. It develops much deeper in the brain than the damage caused by many strokes. In order to diagnose her dementia and her small vessels disease, Mrs. Porter had to undergo brain scans and blood testing. CT scan was used to check and confirm her signs of stroke. An MRI was used to confirm the dementia diagnosis and the disease causing the dementia, which in her case was small vessels disease.
Certainly one of the scary things that's happened, particularly the manner in which it happened.
How did it happen? Explain me the
Well, I
events that led up to
had
it.
been to church. I came home. It was a Sunday. I'd been to church. I came home. I had a sandwich. I was sitting in the chair in the living room and sort of dozed off, woke up, and the world was spinning so fast. I could not see anything. I could not get it to stop. I could not get my eyes to focus. So I then thought I was going to get sick. So literally I crawled to the bathroom. Then I thought that men and women have strokes differently. So I crawled across the hall and called 911.
Was it a stroke or a heart attack? Because earlier you said it was a heart attack.
It was a heart attack. It was not a stroke.
Okay.
Definitely it was a heart attack. And it was mild as they go.
For
But
a
it
heart
was
attack.
a heart attack.
How long were you in the hospital? Do you remember?
I was in the hospital for the stroke, the heart attack, like overnight. But then I had to go to be in rehab for 5 weeks because I had to learn to walk again. Because the vertigo left me unable to walk. Balance was horrible. I couldn't walk without a walker or assistance.
Upon finding out that you had dementia, vascular dementia, what has been the most difficult parts of your life with it excelling?
I get confused driving in new places.
Do you sometimes just get confused throughout like the evening time?
Not particularly.
Has it been getting worse though?
It was getting worse until I stopped drinking alcohol.
Alcoholism is seen as a catalyst in many vascular dementia patients.
Are there things from long ago, your past, that you don't remember much of?
No, I feel like my memory is fairly good on that. I think of things that I forget sometimes are short-term issues. Not old issues, more short-term.
What are the most types of things that you typically forget?
Somebody's name. Mostly it's stuff I can't remember, like what I ate. I just can't pull the name of it up.
Do you take any meds for?
No. I take medication, but not for dementia. I take medicine for high blood pressure.
Because vascular dementia is mainly tied with the blood vessels, her blood pressure medication does help with her dementia, in which it can help prevent future strokes and damage to cognitive functions. Sadly, it's not curable, but treatment aligns itself with ways to slow down the progression, such as quitting smoking and drinking, and hypertension drugs, and sometimes Alzheimer drugs that have been found effective in treatment of vascular dementia. After her stroke and diagnosis, Miss Porter is back doing what she loves and trying not to dwell on the fact that she is slowly dying.
Are there a lot of things that you want to do before you do start to forget things a lot more and aren't able to speak and remember even the bigger things of life and smaller things of life? Like how to brush your teeth and stuff?
Oh God, that's horrible to think about. I'm hopeful that that doesn't happen anytime soon.
But are there definitely things that you want to do before then?
Well, lots of things would be to travel or go places. You know, that depends on whether I can or not. But, you know, they are kind of the things I would like to do. Like everybody, you know.
What are the things that you do every day to keep your mind off of it and just stay as normal as possible?
Well, I knit a lot. I'd like to knit. It's a very relaxing, calming thing to do, and it keeps your mind active. I also I play Sudoku. I do crossword puzzles. I read. I still cook. I can follow recipes. I know when it's time to put gas in the car. I don't know.
How is dementia impacting her family, but mostly her daughter?
It's because I forget things, and then I ask things or I tell things more than one time, and so she gets annoyed with that.
Well, you know, I'm concerned about her safety and well-being.
What are you scared about most for her future?
Having to take care of me.
That we'll have to take care of her. Mean that she won't be able to take care of herself.
Have you thought about putting her in a home?
I don't feel like she's quite ready for a home.
Although Miss Porter is not there yet, nursing homes are an option for care as dementia progresses and patients can no longer care for themselves and their needs are far greater than what their spouse can provide for them.
At this moment in my life, I am able to live by myself and to manage myself. I can cook and plan and eat.
She is doing okay as of today, but because of the disease and its progression, she won't be in years to come. But she tries to live as normal a life as possible and not dwell for the future, as for her life may be floating away.
I am by nature a person who does not tend to worry about things. I have friends, and one in particular I know, who is panic-stricken that she will have dementia, and she frets over it all the time. I don't. It's not my nature. It is my nature to live today and try to go on with life.